touch somebody's love. Make this world a better place if you come.
Is that before I started volunteering, I had this idea that if someone was homeless or someone was poor or someone was, in a situation which I sort of deemed to be, worse off than mine, I always thought that was their fault. I had no idea that sometimes things are just put on people, and people are in situations that they have no control over, and that they're doing everything they can to get out of it. And I think we have to help people who aren't as well off as us, and what you get out of it as a person is so far outweighing what you put in.
The African Children's Mission is an organization that has a campus there, and they provided a facility for us. They brought the students and the patients. They recruited the students for me. They provide the infrastructure because, I didn't know anything about Uganda or even how to get there without their help. So and they're used to taking mission volunteers over their mission teams, and so that's kind of right up their alley. It's not a hard thing for them to help with what we're doing. Since God has worked in my life, I've come to realize that life is all about relationships. In other words, what I tell people, I say you cannot be a Christian and live alone on a desert island. It's because Christianity is about community. And so what I've thoroughly enjoyed about being a volunteer in mission is getting to meet people and have get involved in their lives, maybe just a little bit, but then learn about the way they live and what the challenges are that they have in their lives.
I kind of got into public health as a need to assist someone. Someone asked me, would I be willing to come over and help them? And I said, sure, why not? And once I got into public health, I was kind of essentially hooked. We're under the whole umbrella of Whiteford Community Program. And Whiteford Community Program was started by a group of physicians from Emory University who formed a collaborative with Atlanta Public School System, and they wanted to impact the community through its health care. From that, other arms of the organizations grew. Not only do they impact healthcare, but they thought it all went together to impact all aspects of what makes them a successful person. So the whole idea was to come in and empower a community to help themselves. Well, when I first got to Atlanta and I was kind of seeking to help out in the community because I volunteered all my life, I heard about Ben Massell, and they are a full-service dental clinic that offers all dental specialties. And there's no other clinic like that in Atlanta. Good Samaritan offers dentistry, but they offer medical services as well. Ben Massell only offers all aspects of dentistry. And they have payment plans that they institute, and so much down, so much a month. And then basically people can, you give them time, people can pay for it. And people are really not looking for handouts. They just want to look for a means, a way to do what they need to do. But they're really not looking for, give me something. They're looking for, listen, how can you help me get from point A to point B? And that's what not only does Good Sam offer that, we offer that here in the school-based clinic. The thing that's most satisfying to me is that people really appreciate it. They really, truly appreciate it. And the hugs and the tears and the thank you so much, you can't beat it. There's no price for that. And you really know you have made a difference in a person's life. And they're really, really appreciative of it. And to me, that makes all the difference. And when I feel like I impact things here, but I really feel it at Good Samaritan because they're overwhelmed. I've had them cry on me and say I couldn't get it done, I couldn't afford it, no one would see me. And when I'm able to help people out, that gives me satisfaction. So what I like people to take home is kind of come join me. Let's get it in the school system. Let's get it so that our kids respect their teeth. I would love not to fill a tooth. I would love not to take a tooth out. I would love just to have healthy teeth and healthy lifestyles.
One day we'll be asked, you saw me naked, what did you give me? You saw me hungry, what did you do? You saw me sick and dying at home, what did you do?
Reach out, lean on me. Reach out, lean on me. Reach out, lean on me.